Hi, this is Dr. Ramon Rodriguez, and welcome back to the Parkinson's Doctor channel. And today we have a very interesting topic. Today I will be talking about dizziness. Dizziness, an extremely common complaint in their neurology clinic and an extremely common complaint in the movement disorders practice. So let's go ahead and just jot down the title here. Uh, Today we're talking about dizziness. And there are three main causes of dizziness that I see in my medical practice, especially in the Parkinson disease population. And my plan is to discuss one by one and give you some hints about how you might be able to differentiate one from the other. So the first type of dizziness, because that's the main question actually, when you when you go to see your doctor and you tell them, doctor, I am dizzy, right? The first question is, what is it that the patient means by dizziness? Some people mean that they feel like they're going to faint. Some people mean that they feel some disequilibrium, and some people feel like the world is spinning around. So you have to make sure that you're defining to the doctor exactly which type of problem is it that you're having. So let's begin with number one, right? So the first one that we are going to discuss is vertigo, right? And in vertigo, this is the type of dizziness where the world is spinning around, or you might be spinning around. And typically, the person will move from side to side and they will feel like the symptoms will be aggravated. Sometimes, some people will feel like turning the head to one side, in particular, might be a trigger for the symptoms. And then other people feel like they're rolling in bed. Well, when they're rolling in bed is when the symptoms happen, right? And most times, this is a problem in the middle ear. And you probably heard this story before. We have these very small rocks in the ear, and they just go out of place. And you're just going to keep it simple because the idea of this is to have a general idea about the problem that we're seeing. But when that happens, the plan is to put these rocks back into place. So I usually recommend my patients visit a physical therapy that specializes in vestibular therapy. And the reason is that not all the time we will be able to fix this problem in one visit in the clinic. So the vestibular therapists will, these therapists are being trained to provide this kind of treatment, and they will take you through multiple sessions to try to fix this issue. We have to be very careful. So, because this is the kind of dizziness where a medication called meclizine is typically prescribed for, but in the Parkinson disease community, this medicine might cause somnolence. It might cause some memory problems, and it actually may make things a little bit worse. So we have to be very careful. Obviously, in younger people without Parkinson's disease, they might be able to tolerate this medicine very well, but be very careful. I'm just going to write this medicine here. Be careful. Be careful with medicine. Okay, it's not that you cannot use it, but be careful. All right. So So that is the first type of dizziness that I see in my practice. The world spinning around. Most of the time, what this means is that they're having vertigo. The second type of dizziness that I see is disequilibrium, right? That's how we define it, disequilibrium. And in this case, what happened is people feel like they're just drifting from one side to the other, or they feel that they're unsteady. And many times, some people tell me, I just feel like I am drunk, doctor, all the time. And I feel like I have a cloud in my head. It doesn't even let me think properly. And this type of dizziness can have many, many causes. So in first place, the most common cause that I see is that people are just taking too many medicines. They might be taking two or three blood pressure medicines, and on top of that, they are taking the diabetes medicines and cholesterol medicines. And when people are taking too many medicines and you are 70, 75 years old, your body's not working as when you are 20 years old, right? We cannot lie about that. And there might be some interactions between these medicines that might be making you feel that way. So my recommendation when I see a lot of medicines is can we minimize or decrease the number of medicines? And I'm not telling you to go ahead and do this on your own. This is actually the conversation that you can bring to your doctor. Just telling them, doctor, do you think that taking so many medicines might be the problem? What is causing the problem with the dizziness that I'm having? And your doctor will try to minimize the number of medicines, but you don't do this on your own, right? Uh, this is medical information. It's not medical advice for you to engage into making these changes yourself. Now, the other common cause that I see for disequilibrium is actually people with peripheral neuropathies. And the reason is that we have these sensors in our feet, let's just put it that way, that helps convey the information about where we are in space. And uh, many people with Parkinson's disease might suffer from a sensory neuropathy, and this information might not be getting to the brain, and the patient will experience this sensation of disequilibrium. So once again, this is something to consider. The typical exam for this requires, for you to take your shoes and your socks off. Your doctor will have a tuning fork, and he might have some other tools to check the sensation in your feet, and that's the way that your doctor might be able to tell whether there might be a problem in that domain. Now, the third cause of dizziness in Parkinson's disease is probably the one that I want to pay the most attention to. And the reason is that, it just have a big impact, and we might be able to do something about it. And let me tell you, that third type is called orthostatic hypotension. And actually, I am going to follow this with another video just about orthostatic hypotension, and why is this happening, where this is coming from, and then how you can bring this information to your doctor, so you can establish the dialogue and might be able to find the treatments that you need to make you feel better. But how is orthostatic hypotension different from disequilibrium and different from vertigo, right? So people with orthostatic hypotension, almost exclusively they feel dizzy when they are standing up, after they stand up. And the way that they describe their dizziness is the sensation that they are going to faint. That is 90% of the times the way that patients will be describing how they feel when they are suffering from orthostatic hypotension. And what happens is that orthostatic hypotension is defined by a drop in the blood pressure, 20 millimeters of mercury systolic or 10 millimeters of mercury diastolic, when you change from the sitting down to standing position. And this problem might be observed between 1 and 10 minutes after you stand up. Some people might even be seen immediately, right? And sometimes patients begin to recognize, and they come to the clinic and they tell me, you know what, doctor, when he falls typically after he stand up. Once he stand up and he's able to catch himself and do well, he will be able, or she will be able to walk, and she's not going to fall down. But that transition after they stand up for the next few minutes is the time frame that he or she is more likely to fall down. And the patients very well will describe the sensation that they might faint, or they will feel very dizzy, and they will have to hold themselves, stay steady a little bit, maybe move their legs in order to avoid this. Now, orthostatic hypotension is very important because we might be able to do something about it. I personally feel like I need to speak about this because I see so many people falling down. I see many people getting hurt when they are suffering from orthostatic hypotension, because many times they will even pass out, when they fall down. And sometimes when they pass out, they might end up, they cannot protect themselves. They will hit themselves in the head. They will end up with a broken hip. So these things are critical, right? To understand, it's critical that we need to establish a plan of action for this. The main treatment for this in first place is to drink more water, right? And I'm going to tell you, this is a big challenge because many patients with Parkinson's disease decided that they're tired of drinking water. They don't want to be drinking a lot more. And I have to tell you that I have people that spend the whole day drinking less than 16 ounces of water. and it's just unacceptable, right? If they're having this problem, if you do not drink sufficient water, things are not going to get any better. So there are other medicines as well for people that are drinking water, people that are using the compression socks, and then there are some other medicines that we may be able to use for this condition. However, I'm going to explain that in the orthostatic hypotension video because this condition deserves a video on its own for you to have a better understanding. I hope that you find this video to be useful. I hope that at least you're having an idea. You might be able to think about how is it that you or your loved one might be experiencing the sensation of dizziness, and this is critical for you to bring this information to your doctor and get the right treatment. Once again, thank you very much for watching. I suggest that you subscribe to the video and hit the bell for you to receive an alert when the new videos are posted. And I will appreciate your feedback. Feel free to write in the channel about the subjects that you would like me to speak about. Obviously, I cannot answer the question. If you tell me your particular situation, I cannot answer that question that way. But if you put it in a general term, I will be more than happy to speak about it. Thank you very much, and until the next video. Thank you.